The swelling starts before the pain does. Most people notice it the wrong way around. They feel the bite, look at the puncture marks, and think they know what's coming. They don't. Venom is already moving before you feel anything serious. The lymphatic system picks it up first, not the bloodstream. That's what makes the first 5 minutes so specific. What you do or don't do shapes the next several hours. The instinct is to suck it out, cut it, tie it off. None of that works, and some of it makes things worse. Cutting opens a path for infection and doesn't retrieve venom. Suction removes less than 2% in the best conditions. A tourniquet concentrates the venom in one tissue zone. It doesn't stop it, it traps it. The tissue sits in venom while you wait, and it breaks down. What actually matters in this window is far less dramatic. Keep still. Movement accelerates lymphatic circulation, which moves venom faster. A bitten limb that stays at rest, at or slightly below heart level, buys time. It's not much, but in snakebite, time is the only resource that matters. The venom itself varies enormously depending on the species. Hemotoxic venom from pit vipers and some African species attacks blood clotting. Internal bleeding can begin before pain localizes clearly. Neurotoxic venom from cobras, mambas, and certain Australian species targets nerve transmission. Breathing becomes labored before pain reaches full intensity. That mismatch, feeling relatively okay while function is dropping, is the real danger. A person bitten by a taipan might still feel ambulatory for 40 minutes. By the time legs go heavy and chest tightens, the window is closing fast. Some cytotoxic venoms destroy tissue directly at the bite site. The flesh around the fang marks begins to die within the first hour. Reconstruction of that tissue is difficult and sometimes impossible if antivenin is delayed. Three things matter most in these first 5 minutes. Identification of the snake if it's safe and instant to do so, not pursuit, not capture, not a photograph that takes 30 seconds. A quick look at pattern, head shape, or color from a distance is enough. That detail helps emergency teams select the right antivenin faster. Second, immobilization of the bitten limb. A rough splint or sling made from whatever's nearby works. Third, getting toward emergency care as directly as possible, not waiting to see if symptoms develop. Symptoms confirm envenomation has already progressed. The people who fare best are the ones who move toward help immediately, before swelling, before nausea, before numbness settles in. The 5 minutes after a bite are quiet ones. That quiet is not safety. That quiet has a name in emergency medicine: the latent period. It lasts differently depending on venom type, body mass, and bite location. For some species, it is 20 minutes. For others, it stretches past an hour. It feels like nothing is wrong. The body is working hard underneath that feeling. The immune system has already flooded the bite site with inflammation signals. Capillaries are leaking fluid into surrounding tissue. That's why the limb swells in a ring that moves outward, not inward. Clotting proteins, if the venom is hemotoxic, are being disrupted at the molecular level. Blood begins to lose the ability to stop itself from bleeding. A small cut at this stage doesn't clot the way it should. That's a sign most people wouldn't think to test for. The neurotoxic process is quieter still. Acetylcholine, the chemical that lets nerves signal muscle, gets blocked at the junction. Eyelids may droop first. Then swallowing becomes slightly harder than it should be. Then breathing muscles slow. The person may still be speaking calmly while their diaphragm is beginning to labor. Antivenin works by binding free venom molecules and neutralizing them. It cannot reverse tissue already destroyed. It cannot restore nerve junctions already blocked beyond the threshold. This is why the window is not just about survival. It's about how much function comes back afterward. Studies from Southeast Asia and Sub-Saharan Africa show delays beyond 4 to 6 hours sharply increase permanent injury. That's not a scare number. It's the biology of how much damage becomes irreversible. There is one more trap worth naming. Around 40 to 90 minutes in, some bite victims feel genuinely better. Adrenaline drops, initial shock fades, and they reinterpret the calm as recovery. Some have walked away from help at this point. That decision is catastrophically wrong. The latent period is not improvement. It is the gap between venom entry and systemic collapse. Real emergency response to snakebite is not improvised. Antivenom administration requires clinical monitoring, allergy protocols, and equipment ready for anaphylaxis. This is a hospital procedure, not a field one. Any scenario involving a suspected venomous bite needs direct, fast contact with emergency services and poison control. Training and professional response are the only tools that actually change the outcome. What the first 5 minutes really determine is distance to care. Every minute spent cutting, sucking, tying, panicking, or waiting for symptoms to declare themselves is a minute not spent closing that distance. The venom doesn't pause for any of it. The body that moves calmly toward help, limp still, heart rate controlled, is the body that gives medicine the most to work with. That's what survives the bite, not the reaction to it.